Hi, welcome to Raven Medical's quick introduction to the first aid care for eye injury. The eye is a complex organ with multiple individual structures. Its first aid is very unique, and we have to take very good care because it can have serious impact on the patient's quality of life if they have an injury to their eye. We're going to discuss 4 mechanisms of injury for the eye. We're going to talk about chemicals in the eye, foreign objects in the eye, arc flash exposure, so exposure to welding injuries, and possible infections of the eye. When conducting an assessment of the eye injuries, there's a number of things we want to have a look at. First, we want to see if the gaze and movement of the eyes is equal between both eyes. If we're looking for objects in the eyes, they can be hard to detect, so we have to have a really good look and using light that's shined at different angles. Second, we want to look at the general condition of the eyes. Are they red, watery? Do they look inflamed? Is there pain or burning association with the eye injury? When we're evaluating and assessing injuries for arc flash or welding related injuries, have to be aware that these symptoms can have a gradual onset over 6 to 12 hours. As well, the eyes are painful, there could be blurred vision, and the patient be experiencing sensitivity to light. From the assessment, let's move on to the treatment. Let's start with the easy treatments, foreign objects in the eye. Have a look, and if the object seems loose or floating in and around the eye or just under the eyelid, the best treatment is to flush it out with copious amounts of water. If the object looks stuck or embedded in the eye or the eyelid, then we don't remove and we don't try and move it. So at that point, we're just applying bandages and taking them to the medical care. The management of chemical exposures to the eyes depends on the chemical. First, you always want to consult the SDS and see the explicit treatment. If there is no SDS readily available, look at if it's a dry chemical, then we want to brush it off as much as possible. If it's a wet chemical, we want to flush it with, again, lots of water for at least 15 minutes. After that treatment, we want to bandage the eyes and transport the patient to the hospital. Make sure you have the SDS form with you for transportation to the hospital. When dealing with arc flash or welding injuries, one of the first things we want to do is protect the eyes from the lights. They can be covered with cool, moist dressings, and that will provide some relief of pain, and then we're transporting the patient to the hospital for treatment. The most common infection is called pink eye. Pink eye is where bacteria have migrated in and around the eye, and it looks red and inflamed with a pussy discharge. As pink eye is highly infectious, we do not want to rub or touch the eyes if at all possible. Generally, we just transport the patient to medical care. Sometimes cool dressings relieve some of the pain and some of the irritation. One thing important to remember is to wash your hands after taking care of a person with pink eye, as it's very infectious. To wrap up this brief introduction to eye injuries, there are 3 main points we need to remember. First of all eye injuries need medical attention. Second, any chemical-related injuries, we need to refer to the substance data sheet for details on how to treat that particular chemical. And finally, any foreign objects in the eye should be stabilized to prevent movement, and consider bandaging both eyes to prevent further damage. Thanks for listening to this introduction to eye injuries for Raven Medical.